WNYT, Albany, in HD.
Knowing when to say no to antibiotics, why doctors are being urged to stop overprescribing the drugs. As cold and flu season settles in, don't be surprised if your doctor refuses to prescribe an antibiotic. It's part of a nationwide program called Choose Wisely. The goal is to reduce antibiotic resistance.
Basically, a viral infection lasts 7 to 10 days.
And that, says Dr. Bruce Nash, Chief Medical Officer for CDPHP, is something we all need to remember. Colds, most sinus and ear infections, and generally conjunctivitis. They're all viral infections, and antibiotics don't work against them. Antibiotics work against bacteria. Yet too often patients 3 or 4 days into an illness call the doctor requesting and receiving an antibiotic.
The doctor, under certain circumstances, gives in and gives the patient inappropriately the antibiotic, and lo and behold, in a day or two they feel better, which would have happened had they not gotten the antibiotic anyway.
Dr. Nash says doctors are trained to know the difference between a bacterial and viral infection. And he reminds us, some symptoms we think indicate bacterial infection are really viral.
They think when the discharge from the nose goes from clear to being yellow-green, oh, that is in need of an antibiotic, but it's not. That's a normal body's defense mechanism from a viral infection.
There are two downsides to overprescribing antibiotics. As Dr. Nash points out, 1 in 4 people have a reaction to the meds, including rash, stomach distress, dizziness, and in rare cases, the reaction can be life-threatening. And then there's the broader problem. Bacteria that once could be tamed by these drugs are now resistant to them.
And these resistant bacteria are harder and harder to treat.
Which means one day we'll run out of effective treatments. There are symptoms that should send you to the doctor. Fever of 101.5 or greater, severe pain, or relapsing after you've started to recover. And Dr. Nash says the Choosing Wisely campaign is having an effect, but there are still patients who doctor shop to find a physician who will agree to prescribing antibiotics even when they're not indicated.